Kelly is a 24-year-old female who arrives in the ER because she can't sleep and she feels like her heart is pounding out of my chest. Her vital signs are blood pressure 180/90. Her pulse is 122. Her respirations are 20. Her oxygen saturation is 97% on room air, and her temp is 99.5. When triaging the patient, you notice she is hyperverbal, irritated, and has a flight of ideas. Can anyone tell me what a flight of ideas is?
She's just rambling
Yeah,
on.
she's just
rambling on.
about it.
Exactly. So if you'll turn your back so you can't see when I set up.
Okay.
Okay.
Kelly? Hi, Kelly, I'm Matt. How you doing today?
What are you doing here?
Well, I'm one of the staff here in the emergency room. Can we sit down on the bed for a minute?
No, the supreme being tells me I have to clean the air.
You have to clean.
I have to clean the air. It's not clean. I got to do this.
Miss Kelly, can I have your hand, please?
What? No,
Can I have your
no.
hand?
You know, I remember you.
You
I went
remember
to
me?
nursing school with you. I
You
mean,
did?
yes, I went to
Yeah.
high school with you.
Yeah.
Yeah, and you failed calculus.
All
I
right.
know you failed calculus.
Okay.
I got an A in it. How are you a nurse?
Can I get
Why
some
are you
help in
sitting
here?
here and being with me? Go away.
Can I get some help in here? Somebody stand up. Come in. Somebody stand up in this room and when I call you, I call you. You gonna stand aside? Miss Kelly, let's go ahead and sit down on the bed.
But I don't want to. I got to clean the air.
Here, can I have your arm for a minute?
Okay.
Let's sit back down.
Okay.
Sit back, sit down.
So I have a restraining order on Sarah.
There you go.
I have a restraining order. I need 17 copies of that restraining order.
You need some-
Yes, can you call the police and have them come here?
We'll eventually call the police. if we
No,
need it.
I need them here now. I got to
No.
get those copies right
we're gonna-
now.
Right now, we're gonna make sure you're safe.
No, I'm fine. I
You're
need
going
you to
get
call
a
the police.
blood pressure on?
I need you to call the police. I need you to bring them here. Bring them
We need
here
you to just
now.
Calm down for a minute.
But I,
Miss Kelly.
oh,
we're
what's
gonna
that over there?
Miss
What are
Kelly,
you doing?
We're gonna take
I'm
your
gonna
blood
take your
pressure, okay?
Okay, well, but anyway, I don't know.
Yeah.
You know, I just need those restraining orders.
We're gonna
Will
do,
you,
we'll work on that
no,
once.
I,
We're gonna work on that just a little.
no, I need it now. What are you gonna
Do it
do?
right now. Right
No,
now,
I
we're
need
gonna
you to
take
do
care of
it
you
right now.
Not right now.
Yes, no, I'm gonna
No.
go get them then.
Just go and keep her staying,
Nope,
sitting on the bed.
But
You're gonna want to sit
down.
no, I don't want to. I need those restraining orders.
I know. Let's go ahead and lay back on the
No,
bed.
I
please.
need you
Please
to
lay on
get
the
those
bed.
restraining
I'm
orders.
telling you, please lay on the bed.
If that person comes here,
Please lay
then,
on the bed.
no, I need those restraining
Please
orders
lay on the
now.
bed. Please lay on the bed.
All right,
here.
All
I'll
right.
help you.
well,
Come on. Here,
I'll
you
help
lay,
you.
and I'll help you with your legs, okay?
Okay.
Go ahead and lay back down.
So- yesterday I was going to school.
Miss Kelly,
and-
lay back for me.
Well, I don't want to lay back. Yesterday I was going to school and my car stalled but
Look, we have a
Hey,
nice pillow for you.
it's
Look
nice
after.
out.
It is nice out.
Oh, yes, I
Go
need
ahead,
to
lay
do
back.
this,
Do me a favor,
but,
just sit with her for a minute. I'm
Yes,
gonna go
absolutely.
talk to the
Do you want
doctor.
to lay back?
okay, that's the end of the scenario. You did exactly what you needed to do. All right, so now we're gonna do the debriefing. Okay, so Matt, give me something you did great at.
Setting a boundary and getting you to sit down and get you in a safe position.
Correct. Safety is always the number one priority, right?
Right.
Okay, give me something you may need to work at.
I could have stayed back a little bit. I could have called for help a little bit sooner,
Okay,
as I've seen someone standing in the bed and walking in the room. I should have said, can I get some help here? Because I knew I was gonna need somebody to get her down.
absolutely. Okay,
Because I, trying to get her down by myself would have been, she could have fell the other way.
correct, correct.
So that's
If I
why,
wouldn't have been compliant, what would have possibly happened?
well, you could have fell. And that could have caused an injury.
But what else could I have done instead of falling?
You could have also hit me.
Correct,
Yeah.
correct.
From that, from that angle, you had a direct ability to. you had the upper-
Absolutely. When you were right next to me,
Yeah,
I
you had the
sure could
ability
have done that.
kick me and stuff like that.
Absolutely.
So that's why I could have kept my distance a little bit there too.
And give me another thing you did great.
Go and get the doctor. after for a med, because she's gonna need something to calm down,
Correct.
and her blood pressure was already elevated, her pulse was elevated. So she was agitated, maybe we need maybe a little Ativan, if she's not allergic to that or something like that, maybe a little something to relax her, so we can get her where she needs to be.
So you guys, tell me one thing that Matt did great.
He never turned his back on the patient.
Okay, he never turned his back on the patient. Why is that important? Unpredictable, safety, absolutely.
She could have jumped and grabbed him around the back of the neck if he turned around.
Absolutely, I could have actually wrapped my leg around his neck. He was
Yeah.
that close.
Yeah,
I could have grabbed my leg and either kicked him in the head or just jumped on his head. Give me something he needs to work on.
be honest, guys, I could take it if you need, if you can't do something.
I mean, I think he did good though, yeah.
Okay,
He was very calm.
Yeah.
okay,
He didn't like instigate at all, and he just like kept redirecting to where we actually needed to go. He was sitting down.
okay. Tell me about his nonverbal communication.
Got down to her level, he was looking right in the eyes.
Okay, but why do you have to be careful with that?
Because you can get hit. I mean,
That patient's very unstable,
Yeah.
right? Getting down to their level, you're putting one of your most vulnerable spots right down where they are. What about,
I felt, can I? I'm sorry.
yeah, no,
I felt calmer. I felt like you weren't in an angry state. You were in a confused state that needed more direction. That's why I felt a little bit more comfortably being closer to you. If you had started raising your voice, if you had started elevating, like really getting angry, I would have backed off.
Okay.
But at that point, I felt like I had ability to come in and calm you a little bit. That's why I felt safe in that part.
so
When
what
I-
diagnosis do you think this patient had? Or
Well,
what was going on in this scenario?
schizophrenia,
yeah.
maybe?
Mania?
Yeah.
It was in a manic episode?
Manic episode.
Why does that usually happen?
They got
Probably
highs
off
and lows.
meds.
Exactly,
Yeah.
definitely.
Yeah, it's,
She didn't take her meds. She's been off them for a while, right?
that's the reason why I felt comfortable coming down, so I could maybe bring you down without non-pharmacological
Mhm.
way of intervening.
Absolutely,
But then when you start getting up and you want to do it, that was a danger to yourself.
Correct.
Because I don't know if you're wearing non-hospital slipper socks,
oh, yes,
so that could slip on these floors.
Absolutely.
You're a danger. So that's why I wanted her to stay and go get the doctor and that.
absolutely, absolutely. I think you did a phenomenal, so we're gonna do the last part of the Pendleton debriefing. I think you did a phenomenal job.
Thank you.
And as you said, I think keeping your distance a little more,
Yeah.
but ensuring that the patient is safe. Again, patient safety, but your safety comes first.
Yeah.
Why? Because you can't help that patient if you're not safe, correct? Okay, so,
Thank you.
I think asking for help when you did was both good and, as you mentioned, when you walked into the room and saw her standing on the bed, that might have been the time to turn and say,
Yeah.
hey, can I get a little assistance in
Yeah.
here? Even if it wasn't needed, it
Back
would
up
have been
attendance.
there before you had to raise your voice and yell for it.
Yes.
Could have, I suppose it could have escalated the situation by you
Yes.
raising your voice.
Yeah.
Not, you weren't yelling at her, but you were yelling for somebody, which could have been
Yeah.
interpreted as
Yeah.
escalation.
but I also wanted to add that you did a great job at keeping your tone.
Oh, definitely.
Because a lot of times, students, nurses, they will raise their voices, not because they're yelling at the patients, but because they're excited. Okay, I know for my own personal, that's part of the problem that I have. When I get excited, my voice goes up.
Yeah.
And it seems like I'm yelling at you, but I'm not.
Yeah.
Why? Because if I'm yelling at you, this whole building will hear me.
Yeah.
Okay, I have a really big voice. But as nurses, we need to understand what is in our personal bags.
Yeah.
And your calm demeanor was perfect, right on.
Thank you.
And that's how we have to be.
Thank you.
So I think that was a great, what we need to do.
I also wanted to re-emphasize the fact that you were doing your best effort to build those boundaries, to set those boundaries. You didn't lie to her. You said, if we need to call the police for you, we
Mhm.
will. You know what I mean? You didn't minimize her concern with your words. You just said, when it's time, we will do that. And you
Yeah.
just set the boundaries that she couldn't argue with. She tried to at first, but she
Yeah.
couldn't argue with that.
And I will be honest, in the script, if you would have said you were not calling the police, I was about to lose my stuff.
Okay,
I was going to start yelling, and that's actually in the script.
okay.
So by you keeping your calm demeanor, what can I argue with you about? There's not much. So a lot of times, these patients just need a listening ear.
Mhm.
They need, as long as they're safe, just listen to them, let them calm down and medicate them.
Yep.
That's the best avenue that you can do for these patients.
One of my mottos is you can't argue with crazy.
No.
And I don't mean that disrespectfully,
No.
but in their manic state, you can't argue with that. You just have to set those boundaries and kind of get them to the next place in the conversation. You know, by rationalizing with somebody who is in a manic episode or otherwise, it's
Just
gonna be
rules.
wasted breath.
Well, like, you didn't argue with me that we weren't in school together. You have no idea who, you've never seen me a day in your life. But you didn't argue with me. You just said, oh, okay, yep, yep. All right, well, we need to get you on the bed. And that's perfect. Why? Because the minute you start arguing with them, you're giving them power. Why? Because that argument turns into something else. Okay, and that can escalate it at the drop of a hat. So great job.
Thank you.
You're welcome. You want to pause for a sec?
So now I'll fill the sheet out for the next one. Thank you for your help. Thank you for letting me know.
So Sasha is a 52-year-old female who's admitted to the medical surgical floor where you are working. She is scheduled to have her toes removed from her left foot due to uncontrolled diabetes. The patient has a history of type 2 diabetes, high cholesterol, hypertension, and substance abuse. The patient is receiving IV antibiotics 4 times a day for the infection. You enter the room to do the antibiotics.
Hi, Sasha. I'm Holly. I'm your nurse.
Can I get some pain medicines? My foot is killing me.
Yes.
I need to, no, I need it now. It's killing me.
Okay, let me do this medication right now, and then I'll check your chart and see if you're ready to get some pain meds.
And it's not time for pain medication.
It's not time for
Yep.
pain medication. Okay. I'm gonna check and just see what we can
But
do.
can't you give me something else?
I think we just gave you some medication.
But it was a while ago. Is there something else you
Are
can
you
give
having
me?
a lot of pain?
Yes,
What
a
is your
lot of pain.
level?
About a 10 out of 20.
10 out of
Yep.
20? Okay. Well, let me check with the
I really
doctor.
need some pain medication. I'm hurting.
Okay,
Can you
can I
help
take
me?
a peek at your toes? and
Absolutely.
just- Okay,
Okay.
let me just take a look.
Ow, that
Okay.
hurts.
Okay, so I see you're in a.
No,
pretty
don't
good
touch
amount of
it.
pain. Okay.
Yes.
All right, well.
Why
let
would you
me check
touch
with-
me?
Let me check with the doctor and just see if there is a chance that we could possibly get some more meds for you. Because maybe what we gave to you wasn't strong enough.
That
That's
hurts.
taking the pain away. Is there anything that I can do? Maybe put some pillows under your
No,
legs?
nothing works. I
Nothing
just need
works?
some pain
Okay.
medicine, okay?
Okay. So let me check with the doctor and just see if there's something that we can do.
Hurry
for
up,
you.
I'm in a lot of pain.
Okay, is there anything that I can get for you right now?
Some pain medicine, I told you
Okay.
that
Is
already.
there anything else that I can get? for
No,
you? Okay, let me check with the doctor and find out what we can do.
There is an order for Tylenol.
Okay. There is an order for Tylenol. Would you like to try that?
what the
See if
hell is
that
Tylenol
will-
gonna do for me?
Well, it may take the pain level down a little
Yeah,
bit.
okay,
because
no,
I know
no.
you're scheduled for surgery in a few
no,
days.
no, Tylenol does absolutely nothing. You know
Well,
what,
why don't
I'll
we
just wait on the
try
oxycodone.
Are you sure you don't want to try?
No,
it just to get
Tylenol
pain
does
level?
absolutely nothing. That is candy.
Okay. Well, if you change your mind, just let me know. You have the call button And you can let me know if there's something else that, if you'd like me to come in and give you some pain meds.
I can't believe you can't give me anything for this pain.
Not yet. We have to wait so many hours before we can.
Okay, fine, you can't do anything for me. You need to go.
You're here to do the antibiotics.
Okay, well, I'm here to give you antibiotics. So let me do that because that will actually help a little bit. So,
Fine.
would you like me to do the Tylenol at the same time?
No, I told you, I don't need the damn Tylenol.
Okay, well, I'm gonna do the antibiotics, so.
You've noticed that there's air in the line of your antibiotic tubing.
Okay. Let me just see here. Okay, so I would have to change
You'd have
the
to
line,
leave the tubing maybe.
right, leave the tubing, change the line. Okay.
What are you doing? Isn't there air there?
I'm going to flush the line.
You're
Okay,
gonna,
just make
you're
sure
gonna
that
bleed the
your
tubing
IV is okay.
like
I'm gonna
into
bleed
the
the
sink.
tubing.
What are you doing?
I'm just making sure that.
I
there's a
hear
little
it
bit
going
of
into
air.
the sink. I hear my medicine going in. What are you doing?
It's not your medicine. it's
Yes, it
just-
is.
It's just the,
No, that's my medicine. You need to get another bag.
I'm going to get another bag, but I just want to make sure that you don't have any air.
I hear the
Going
medicine
into
going
it.
in the sink. You're throwing away my medicine. I need that
I
medicine.
promise I'm not throwing away the medicine.
You're throwing away my medicine. Get me another bag.
I'm going to get you another bag, but I'm not throwing away your medicine. I promise you.
Yes, you are.
Your medicine is here, so I am going to put your medicine in.
You just threw it away. No, don't give me this one. You threw it away. Go get another one.
That's the IV bag, and that is just to keep
No.
you hydrated. That's all it is. That's
No,
not
that
your
was antibiotics up
antibiotic.
there. Yes, it was. There was antibiotics. You threw away my antibiotics.
The
Go get me another
antibiotics are
bag.
still up here.
Go get me another bag right now.
Call for somebody so that we can get you another bag. Can you come and help?
Sure.
Thank you.
I want another bag. She threw away my antibiotics
So
on me.
they're in the line, and so. in
She's
the
lying. I heard her throw it away.
Ma'am.
I heard it going into the
Antibiotic.
sink.
Ma'am, I just need you to calm down for just a minute, okay? What was going on?
So there was some air in the line, so I just.
Again,
let the air out of the
She's
line
lying.
Of
Ma'am,
the IV. So I haven't given her the antibiotic yet, but I'm going to do that now.
I want a new bag.
ma'am, this.
I heard it. I heard it being thrown away.
Ma'am,
Get me a new
Ma'am.
bag.
Ma'am, please stay calm. All right, we're gonna work through this. She's gonna hang the IV back. You're not losing out on any medicine.
Yes, I am.
Ma'am,
Get me a new bag.
Ma'am,
I want a new bag now.
ma'am, you need to calm.
No, get me a new bag. I heard it going in the sink. Get me a new bag. Now. Are you gonna stand there or are you gonna go get a new bag?
I'm gonna stand here until you calm down.
Once you get a new bag, I will be calm. But she threw away my antibiotics. Go get me a new bag
Ma'am,
now.
she
Your
did not throw any of
antibiotics are
that.
still.
Yes,
here.
she did.
No, ma'am.
Go get me a new bag now.
Your bag is.
I don't want to hear it. Go get me. You know what? Get the manager.
Do you want
Get the manager.
Okay.
Okay, let's. grab
I
the
want a
manager.
new bag of antibiotics. She's
Manager.
throwing it away.
Who wants to be the manager? Manager?
Somebody stand up, please.
Yes, please. We're looking for the manager.
I understand.
Done.
Okay.
Oh, my goodness.
Oh,
Why did you get the easy one? She's difficult.
No, but that's what I.
So I'm going to tell you, this was an actual patient I had. I changed the name, but that was an actual patient that I had. And she was a lot worse than I was.
Mhm.
Okay. This is a patient I encountered on a med surg floor. You okay?
Yeah, now would it have been like, do you think, or like,
New bag or.
no, well, not only that, but I'm wondering if she
Wait a
had
minute.
high blood sugar.
What is
which
the
was-
problem with getting a new bag?
Well, no, because you're giving in to her. You don't want to give in. because
Well,
then they
Not
drop.
only that, what else?
That,
You have
I
to
mean,
account for the
it's
medication?
a chargeable thing that nobody's gonna pay for.
Right,
Correct.
Right,
that comes from the pharmacy. That's
right.
probably pre-mixed, it's
There's
mixed.
nothing
with
wrong.
other-
But perhaps
Right.
you could have taken it out of the room
And brought in.
And
active.
correct, that's what I was gonna
Right.
do, and then I was
Correct.
like, should I
So
do that?
this is teaching you, like I said, this is an actual patient that I had,
Yeah.
and I did exactly what you did as a new nurse, okay?
Yeah.
I sat there and argued with him and said, no, I did not throw your antibiotic away. It's the old antibiotic you heard going into the sink. He didn't want to hear any of that, okay? So by calling management, because she called the charge nurse.
Yeah.
Okay, and that was the right thing to do. But the charge nurse didn't make the decision to go get the new bag. So what's the next step? If the charge nurse, the manager is your next step. What if you are on an overnight shift and the manager has gone home? Who are you calling?
Supervisor.
House supervisor. Absolutely. Absolutely. All right, so give me something you did great. I know you can find something, because I saw it.
I can tell you 5 things you did great.
Okay, please do.
Okay,
No,
well,
you-
no,
you-
if
Because I
I,
feel so unconfident
No, you go
about it.
go ahead, give her something
One
she did
thing, you
great.
tried using a non-pharmacological way of trying to reduce pain.
Yep.
You offered another med. You found out she had another med. You remained calm and tried telling her that the med was not being thrown down the toilet or in the sink, that you were actually giving the right med for her. You said you were going to get help to help out with, so you were showing you need help. You remained calm. You didn't yell or argue with her, try arguing with her. You did a great, I think, I'm sorry, I think she did good.
I agree, and that's why I said I saw a whole bunch that you did
Yeah.
good.
Okay.
Yeah.
And just because it wasn't the outcome you expected,
Mhm.
okay, does not mean you didn't do a great job, okay?
Okay.
All
You
right,
did great. You did
You
pain
did.
assessment.
but
You did pain
give
assessment.
me something that you could have improved on.
Probably calling someone sooner than I did.
No.
I don't think
No.
so.
You think I did good with that?
Mhm.
Okay.
Why? Because you're trying to reason with them first, correct?
Yes.
Are you gonna call the charge nurse for every difficult patient?
No, you want to talk to them and try to calm them down and de-escalate the situation.
Correct, correct. So what do you think?
I probably, you said she had diabetes, so there was a part of me that wanted to ask, like, was her blood sugar high, which was making her angry
No,
because
she's
you get like a little angry. If your blood sugar is high, you get like irritable and angry or whatever.
With a history of substance abuse.
And substance abuse, but
Correct.
see, she wanted the pain meds
She wanted the
because.
Correct,
right,
and I
because-
showed, you didn't recognize, and this
Seeking.
isn't a bad thing, you didn't recognize seeking behavior.
Hmm.
Okay,
Okay,
that is what that patient was doing. They wanted that pain med. I don't care what I gotta do to get it. Now I'm escalated. Why? Because you didn't give me that oxycodone,
right.
right? So I'm gonna escalate. Any little thing is going to set me off. Now, I want every medicine you can give me. Now I think you're throwing away something in the sink.
Right.
Okay, so like Libby had said, taking an antibiotic out of the room with an addict where you have to bleed the air out of the line, they're gonna think anything that you're doing that they can hear is throwing it away. Okay, and it's not everybody, and I'm not trying to generalize, but this, you may encounter this scenario again.
Mhm.
Why? Because I can't tell you how many times I've encountered this since I've been a nurse. It happens all the time, unfortunately. Maybe not that exact scenario,
Mhm.
but the overall picture happens all the time. Have any of you seen that kind of thing on
Yeah.
your clinicals?
Yeah.
See,
The other thing too is when I offered the Tylenol, she said no. So if you're in that much pain, you're gonna take anything that you can, because if it's really your foot hurting as opposed to wanting the drug.
but, and not trying to be funny, but you asked it way too many times about the Tylenol. Once you see the seeking behavior and they refuse the Tylenol, then don't keep asking why, because that is just escalating them even more as well.
Okay,
Okay,
got it.
somebody give me something else she did really good.
She validated the patient's pain by doing an assessment.
Okay, Yep.
Right at the beginning.
absolutely. And it's something else good.
Nice and calm.
Nice and
Yeah,
calm,
stay calm.
absolutely.
Stay like this. The waves are going, but you kept
Mhm.
saving.
So now that they've said some, can you think of something you did really well?
I mean, my mind was going really fast, so I felt like I had went kind of up on my voice, like snippy almost, but I feel like I stayed calm. But in my mind, I was like, okay, lady, like, shut it.
So you were a duck in water.
Yeah, like,
Okay,
I knew,
so
like, you know.
You're looking at the surface
Mhm.
and you're nice and calm. Why? Because all your peers said that you were calm, right?
Yeah.
But underneath, how are you feeling?
Oh, I was like rageful. I was
Right?
like, what do I do? Like, what am I gonna do
Exactly,
now?
exactly,
Yes.
exactly.
Yeah.
So,
You could have easily escalated your own voice and argued back, yelled back.
Yeah,
That's a human response.
but I know that's not gonna
But-
get anywhere. That's.
No.
I did
And it
a
gives
little
her
bit.
something else to get
Because
mad
I
at.
wanted to set, like, I gotta put a boundary, like, I'm gonna be calm, I'm not gonna say anything else until you calm down, because I don't deserve to be yelled at,
Mhm.
you know?
so I'm gonna say something else you could have done, okay?
Mhm.
You could have walked out of the room, taken the antibiotic with you and walked out, rather than just calling the charge nurse in.
Okay.
Disengaged yourself from the situation, gave them a few, you could have said, I'll be back. They don't know if you're going to get another antibiotic like you told them. They don't know if you're going to get some pain medicine. They don't know what you're going to do. But you, I saw, unfortunately, were on the verge of tears.
Yeah, I was
Okay,
like.
so- But what I'm saying is,
yeah.
if you would have broke out in tears with that patient, let me
Yeah.
tell you how that would have ended.
Yeah,
That patient would have escalated because they know they're getting under your skin.
right.
Removing yourself from that situation to give yourself time to calm down and gives the patient time to calm down. So you take the antibiotics down. I'll be
That's what I was
back.
gonna do, and I was gonna walk out, and then I was like, I don't think that that's right. I just, something tells me like, don't do that, but that's what I should.
And you will learn, trust your gut instincts in nursing.
Okay.
Okay. So if you really felt like, oh, I should have walked out for a minute, absolutely regroup.
Look, I got a new bag for you.
Maybe,
You know.
but you
play
could have
the
went and
game, right?
asked, instead of yelling for him and coming in and having him engage in the situation,
Yes.
by taking that antibiotic and walking out and going to get the charge nurse, gives him time to, her time to calm down, you time to calm down, gives a conversation with the charge nurse where the patient isn't hearing,
Right.
and potentially get a new antibiotic bag. All you need is someone to say, yes, go ahead and get another antibiotic bag and hang it. That's all you needed,
Okay.
okay?
Mhm.
And then you could have walked back in, hung the antibiotic, and went on about your day.
Okay, got it.
Do you have anything to add?
One thing,
And I just think that, I mean, like everyone else, I echo the fact that you were trying to be, you were offering what you could, but you weren't arguing.
Mhm.
You can't argue with somebody who's being manipulative,
Right.
because that is being manipulated.
Yeah.
When you.
Yeah.
Like the candy bars.
Right, where I'll just give it and go, okay, here we go.
the
That's
thing that-
motherly
that worked in the
instincts.
past, is like, okay, like, they say, well, I want my pain meds, and I say, well, you got your last dose at 2:30. Your next dose will be at 7:30, because it's 5 or 6 hours. And then say, you'll begin this pain med at this time.
Correct.
It kind of gives them an idea, like, you know what I mean?
But I will tell you, if you say you will get the medicine at this time
Yeah,
and you are not in that room, you just re-escalated
yeah,
them.
I got you.
Oh,
Okay,
yeah.
so if
You'll
you
be due for
say you are due for this medication at this time,
Right.
then that, more than likely, that patient's gonna be on the call bell at that time. Why? They have nothing to do but sit there and look at the clock,
Right.
okay? But by doing that, you delay it, and then they're able to get the pain medication that they want, okay? Asking for more pain medication. Why is, and I mean, I told you it was a 10 out of 20,
Mhm.
so that's a 5.
It's
uh,
unrealistic.
2.5 out of 5.
Yeah.
It's a half. Okay,
Yeah.
so I basically told you I wasn't in a lot of pain. I just wanted that medicine.
Right.
Okay, so if you ask for more pain medication, every time you go in there and it's not due yet, guess what they're gonna ask?
Definitely want their pain meds.
Exactly. Exactly. I mean, you can't take their addictive personality away from them
Yeah.
while they're in the hospital. That's never gonna happen. That's unrealistic.
Mhm.
But by setting those boundaries and, ensuring that they're not in pain, you know, as soon as you touched me, I didn't wince until a second later.
You're right.
Got what
Yeah,
I'm saying?
because I grabbed your ankle and was going to pull
Correct.
the sock down and then you went, no, don't touch me.
Yes.
Okay.
Okay. So I gave telltale signs that I'm not in super pain. You didn't blow on it and I go, oh my God, you know,
Yeah.
like somebody that would be in excruciating pain that may need some more medication.
Right. You
Why?
look-
'Cause you never
look for
wanna-
the nonverbal demonstration of pain.
Now,
Oh, yeah.
I was escalating and I was leaning forward. What do you think that would have done to my foot?
Oh, no, that would hurt. It's more pain. You would be laying back, you'd be grimacing, you know, grabbing the side. Yeah.
Exactly. I gave you no indication. I totally forgot about the foot when we started talking about my antibiotic.
Right. You were just going on and on about the antibiotic.
Correct.
Forget the foot.
Exactly.
Okay.
So great job.
Yeah,
How do they medicate them though? Cause like longtime drug users, at least with like, like pain meds, like they build up a tolerance. So it's hard for the doctors to like kind of gauge, so like a normal dose won't really touch them the way it touches us.
It depends on the person. Because even, yes, you can build up a tolerance, but some people don't. It's all in their metabolism of it. It varies. Task you're in there to do and you feel like it's time for you to leave, do so. All right, so. John King is a 24-year-old male who was admitted to the medical surgical unit for taking too much Benadryl. The report given to you from the ER states John has taken a lethal dose of Benadryl because he and his friends were participating in the Benadryl challenge. You all know what the Benadryl challenge was?
no.
It's, they were trying to take as much Benadryl as they could without passing out. But they would not estimate their weight or other things. And these patients were coming in with lethal doses of Benadryl in them. And it was one of the challenges. Okay.
Hi, John. I'm Nicole. I'm
Hi, how are you?
Good. How are you?
I really like your shirt.
Oh, thank you.
You're
How are
welcome.
you feeling?
Okay, I'm okay. I just don't understand it. All my friends were supposed to be doing this Benadryl challenge with me and no one's here. I feel so abandoned. I mean, they should be here with me. I don't understand this.
It's okay to feel abandoned.
Oh, you're so sweet. Oh, so how are you doing? What are are you married or, what's going on with you?
No, well, we're not here for me. We're here for you.
Okay,
So how are you feeling
I'm
after?
okay.
Yeah.
I'm okay.
Is there anything that you need from me?
No, I think I'm
Get
good.
any water?
No, I just need someone to listen to me. That's all.
Oh, that's what I'm here for. so
Okay.
you can Listen. I'm
Okay.
just gonna take your blood pressure.
Sounds
like, there's
good.
no Vitals. There's a blood pressure phone.
Uh-huh. So what did you do last weekend? Last weekend was a holiday. What did you do?
No, we work a lot as nurses, so it's just working.
Oh, you didn't get to go to any parties or anything?
No, that's not really my scene.
Oh, well, yeah, me and my friends, we're together. We were taking all this Benadryl and we just thought it'd be fun. Next weekend we might do something like shooting beer or something. Yeah.
You should try to be careful though,
Why?
because you never know what could happen.
I'm with my friends. It's fine. You did the assessment. So what are you gonna do?
Okay, I'll be right back, John, okay?
Okay.
And I would go like look at his chart and see if he's due for
Pressing the
any-
call bell.
for any check or any.
Pressing the call
meds.
bell.
Hi, John.
Hi.
What can I do for you?
Oh, I just wanted to see your lovely face.
Oh,
You're just
thank
so
you.
sweet.
I have other patients though, so we just have
But
to.
I'm important too,
No,
right?
very
I don't want you to abandon me too.
No, I'm not gonna abandon you.
Okay.
We're
Alright.
just, I have other patients that I have to take care of, so it's important that you only press the call when you really need me. So
But-
before I leave, is there anything that you need that I can get you?
Guess I don't need anything.
You don't
Go
need
ahead
any
and abandon
ice
me
or
like
water?
everybody else.
Okay, I'll be right back, John, okay?
Okay.
I'm just gonna go, let me go check your chart and make sure that you're not due for any meds and see if there's any other doctors that are gonna come in to talk to you, okay?
Okay.
So I'll be right back, okay?
Okay.
So you haven't heard anything from the patient in 30 minutes and you go and check on them.
knew it before I got up. John, what are you doing?
You abandoned me. I don't want to live
Wait,
anymore.
let me take this, John. Where did
No.
you get that?
It's from my lunch tray. It's
Okay, I
the
need-
knife from my lunch
Okay,
tray.
we're gonna take the knife
No.
away, John.
No,
John.
you abandoned me.
John, look at
I
me.
can't believe you abandoned me. You abandoned me like everybody else, like my dad when I was 6
Can I
years
get
old.
help in here?
Good job.
Right before I walked out the last time I saw that hook.
So you already know what one of the things is.
I should have gone, I should have took that hook away from you. That abandoned comment, I was like, she's gonna hurt herself.
Or.
But, okay, you could have taken that hook, but guess what?
You could have used that and broke it and.
Right, and I mean, with situations like this, it might not have been a suicide attempt. 'cause
Just
it-
attention, yeah.
Just attention.
Yeah, like-
It was a butter, I told you it was a butter knife from my lunch tray. So, give me something you did great.
I redirected when they were trying to ask about my hobbies and stuff, because I knew where that was going.
Okay, and something else I noticed. Okay, give me something you need to work on.
Being awkward.
Again, that is what this is for. Just like I told you guys, that's what these scenarios are for. These scenarios are to make you more comfortable. We hope you don't encounter these, but more than likely you are, unfortunately, during your time as a nurse, as a nursing student in clinicals. That's why we're trying to put this together, okay? So yes, building your confidence is what this is all about. So awkwardness, not a problem. This is a safe learning environment for you to learn in, okay?
And you felt more awkward
Than you looked.
acted.
Oh,
Yeah,
okay.
yeah.
Exactly.
Okay.
So give me another thing you did good.
I noticed the hook there before, like it crossed my mind. I just didn't think of like grabbing it before, but I was like aware. I was like, oh man, because I knew where this was going with the abandoned comment.
Exactly,
So
exactly.
it's just like trusting my gut, like, hey, let me take
What did I
this.
tell you on the first one? Trust that gut, right? Those nurses' gut feelings will get you every time. And every time you turn away from it, guess what? Something bad happens. Trust your gut. If anything, you're trying to keep yourself and your patient safe, okay? That gut will help you every single time. Okay? May not guide you into what you need to do, but it'll make you think. And stop for a moment and think, what do I need? Before you walk out this room, look around. I'm talking about abandonment, okay?
Yeah.
I'm talking about why did you leave me? I just sat here and pressed the call bell as soon as you walked out the room. And then you tell me you have other patients. Does that matter to me?
No.
No, why? Because I feel like I'm your number one priority. I should be it. I don't care how many patients you have. You could have 7 patients and I don't care. Why? Because these people, and this is borderline personality
It's such a
disorder,
good, accurate
okay?
description.
So these people, it's all about them and feeling abandoned, okay? So give me something she did good.
She did good with basically not being rude, but letting him know that she does have other patients, but if he needs anything, then he can hit the bell.
Absolutely.
She set boundaries.
Number one with this group is setting boundaries. Because they may not just say, oh, I just wanted to see your smiling face. They may say, I want a cup of juice. 2 minutes later, oh, I want some crackers. Oh, I want this. Okay. Sitting there saying, all right, I'm going to get you this juice. Is there anything else that you want? You go get it. And when you come back, I'll be back in an hour to check on you, or 30 minutes, or however long. But when you start hearing those abandoned things, you need to look at your milieu. Okay. You need to look and see, what can this patient do? Okay. I'm going to tell you, this right here,
Yeah.
okay? Granted, you can't do much about the bed cords. You're on a med surg floor, you know, but removing what you can helps to deal with those patients, okay?
And if you can't, there are systems in place in hospitals,
Correct.
getting a
One-to-one.
sitter,
Mhm.
even though that's kind of work, kind of giving into what this patient needs, and that's to be the center of attention.
They have those little
Whether
robot
it's a
things.
call for attention or an actual suicide attempt,
Mm,
either one, we do not want any patient attempting when they're in our care. So it may require you to even pick up the phone in the hall, ask for the charge nurse and supervisor saying, I think we need a sitter for this patient.
And then the other thing to think about, it may not be a borderline personality disorder patient. It could be a patient that has no one.
mhm.
Sometimes these patients get admitted to the hospital just to have someone to talk to, okay? Whether it's an elderly person, you see it a lot of times with elderly, someone may have just lost their spouse, have no one else. I just want someone to talk to, and they'll come up with everything under the sun. And it's not necessarily borderline personality disorder. It's just, I'm lonely. It's a cry for help a lot of times. Okay, this patient actually had something that why they were here. And they had borderline personality disorder, but you're gonna see it in other patients as well, this behavior. Okay, and it's something to watch out for. As I said, if a patient's husband, significant other dies, are they looking to be in the same spot? If I ask them, are you having thoughts of hurting yourself? Is that giving them the idea to do it?
No, you're just clarifying how you feel. I
No,
don't think
because
it-
they're probably already thinking prior to that if that's how they feel.
Does any of you think that it could be putting the idea in
It
their head?
could. I mean, you
It
could add
be
some fuel to
accepted,
the
it's
fire.
Such a standardized question.
But the problem is if you don't ask it, guess what?
You don't know.
You don't know the answer.
Right.
It's not putting the idea in their head. It's giving them an avenue and out, okay? A
You
lot
have
of
to have
this
the
is
courage to ask the hard questions. I talked about that with postpartum depression, so.
Mhm.
by asking that question, you're ensuring, and it's not just what they're telling you. Again, this is all about nonverbal communications. Okay, if they're curled up in the bed and, well, okay, you know, or something along those lines, you know, okay? Great job. All right, so Sarah is a 72-year-old patient who is diagnosed with lymphoma. Sarah and her husband of 50 years, Jim, arrived at the cancer center for chemotherapy.
So I'm going to be off camera, but I'm Jim. Okay.
Nope.
No?
I'm Jim. That's okay. I'm Jim.
You're the husband.
Yep, I'm the husband.
Okay.
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 Hi, Jim. How are you today? I'm Rebecca. I'm the nurse here.
But who are you gonna talk to? Are you gonna talk to Jim or are you gonna talk to the patient? It's okay.
Yeah.
Yep. So, you're
Back in
gonna-
the interaction was. with
Yep.
Jim. So Sarah.
but Sarah is your patient. You're gonna address the patient. Okay, so go ahead.
Okay.
Hi, Sarah. How are you today?
Oh, I'm not in the room? Say hi to me. Okay.
Well, hi, Jim. How are you doing today?
I'm okay. So Sarah's here for the chemo,
Okay.
right? So how long is this gonna take?
Maybe take a couple hours.
Couple hours? Okay. So her prognosis, is she gonna live? I mean, this is some heavy stuff.
Right.
I don't, this is my wife.
Sure.
Is she gonna live?
And your concern.
So we just come in to hook the patient up for the chemo.
Okay. All right, well, I'm gonna go ahead and hook Sarah up for her chemotherapy.
Okay.
We can definitely have the doctor come in and talk about her prognosis. How's
Okay.
that sound?
Sounds great. Sounds great.
So
So,
So you hook it up.
All right, so we're hooking Sarah up. Okay, how's that feel, Sarah? Okay?
Bye. You leave to go deal with other patients, and 10 minutes later, you're back to check on Sarah and Jim.
Hey guys, how's it going? Hello. You doing okay, Jim?
no, it's taking way too long.
Remember I said.
I have a over to the library book I have to take care of.
Okay, well,
But
It's gonna take a few hours.
But
Like
I have this
said.
library book that has to go back.
Okay. Do you wanna go and return your library book and come back?
Really? This is my wife. You're giving her chemotherapy. This is one of the most important things.
She's in
Why
good
would you
hands,
tell me to
though.
leave?
But You're
Why would
in
you-
wonderful hands.
Why would you tell, I can't believe you tell me to leave. This is the most important thing in my life. What am I gonna do? What am I gonna do?
Maybe you can return your book later and explain that you were with Sarah here at the hospital.
But I don't know. I don't know.
Sarah is feeling Jim's frustration, becoming more and more agitated.
I understand that your husband's a little frustrated. But you know what happens, that's okay though. Our concern is with you, primarily with you, making sure that you're doing okay.
Sarah, we need to hurry up. I have to go get this library book back.
You have to understand though, it's gonna take a little bit of
But I
time.
have to do this library book and I'm worried about Sarah. What if, something happens
What
and
are
I
you worried
leave?
about more though? Her
But what if
reading
she
the book?
leaves? But
She's not gonna go anywhere.
what do you mean? What am I more worried about? My wife or the book? I mean,
The book
You
is
just-
the book. You can return the book later though.
I can't believe you just said that.
Well, I know you're more concerned about your wife. That's why you're stressed out.
But if I leave and something happens to her, I'll never be able to live with myself. I don't understand. I can't believe you told me to leave and, Okay, that's the end of the scenario.
Jim's
okay?
pretty,
Unfortunately, that's a typical patient spouse.
Yeah.
Are you serious?
Yes.
Like even over something
Yeah.
as trivial as a library book.
well, when
He has
as
anxiety
well.
disorder.
Yeah.
When
Calming
anxiety is-
him down might have
Right.
helped to make sure that, like, letting him know that if he calms down,
Mm.
then she'll have a better experience getting the chemo, so she'll be calm.
That's what I was trying to get into. Say, I understand your stress. And then I was, trying to think of how to say, like, well, if you kind of calm yourself down, then she won't get as stressed.
Do you offer
Yeah.
like to call the library for him?
Bingo! That's actually in the
That's
script.
That's what I would do. with mine.
Absolutely.
I-
You can
I
tell them
actually
what
thought,
time.
like- I actually thought, like, well, can I offer to bring his book back for him? But I'm like,
But bingo. Calling the library. What time do you close? Oh, you'll have plenty of time once we're done. Why don't you go ahead and settle down? She's feeling your frustrations. Let's make this experience, it's already hard enough on her body. Let's not add to it. Okay,
Let's call the library and see if, even if after they close, if it's in the book drop.
will they consider it? Or even explain to the people, ask Sarah, is it okay if I let them know that you're in the hospital? They don't have to know why,
Mhm.
but she's in the hospital. Is it okay if he brings the book back tomorrow? And what library person would say no?
Right.
So tell me something she did great.
She remained very calm.
Very calm.
Yeah,
Very
a nice
understanding.
calm voice, which would de-escalate or shut immediately.
Correct. Correct. Unfortunately, people with a lot of anxiety,
Mhm.
it's very hard. And the problem is he's not the patient,
Right.
Right,
okay? She is.
right.
So can you medicate him?
No, but you can
No.
tell him to,
Can
you
you
can't
put-
remove him from the situation.
Exactly, and that was the other thing. So when I started getting really escalated and kind of in your face,
Mhm.
call for someone to remove him, have him go wait in the waiting room. She's getting more agitated, more
You don't
agitated.
want the patient to be
She
upset.
can't handle it. Why? She's having chemotherapy and more than likely she's with lymphoma. She's probably having radiation too. Her body is drained. Adding more stress to her is not good. Removing him from the situation and say, come on, let me go talk to you in the hallway. Let's see how we can fix this.
Mhm.
Let me go call. Let me go see if I can't fix this. Okay? Because
some breathing exercise, can you recommend that to him? Like,
absolutely, but I'm gonna tell you, a person with anxiety disorder is gonna be very hard. Okay, he's worried about his wife and he's worried about that library book. He's fixated on that library book, but then the minute you talk about going to take care of that library book, what happens? He goes back to the fixation on his wife. He's worried about everything and he doesn't know how to handle it.
Redirecting
When-
him, would you suggest that? Redirecting,
Absolutely.
offering. a snack?
Maybe,
Offering a beverage and
Yeah.
a snack.
Or
the
even
library.
like, why, maybe, why don't you have a seat and, maybe try to talk to your wife, maybe read her a book, it might calm her down.
So the only
For
thing
library
about
book.
telling them to have a seat,
Yeah.
what I have learned in my experiences, you're telling them what to do.
Yeah.
And a lot of times they don't want to hear you telling them what to do.
Right.
Okay, in the scenario, I actually have offer him something to drink and a snack maybe.
That always
And-
helps. Food's perfect.
And give the, go call the library. When do you close? Is it okay if he returns it tomorrow? They're having a procedure done. Is it okay? Coming back with that information and something to eat and something to drink helps tremendously a person with anxiety. Okay, how did you feel when you were going through this?
Not as anxious as I felt sitting here watching others.
Okay, but anxious. I could tell you were a little
Yeah,
anxious and
yeah.
apprehensive.
Yeah,
Okay, that's how he's feeling.
right.
How do you,
Sometimes worse.
how exactly, how do you calm that?
How do I calm the person feeling anxious?
Yeah. So how would you calm yourself?
I'll probably just try to focus on something in the room or, just try to redirect my thoughts somewhere else.
So by helping him do that, maybe it'll help him. But again, not telling him what to do
Right.
is imperative. Okay. So give me something she did great.
She remained calm. I thought we did that. She did good.
Yep,
Yeah.
I'm
Yeah.
looking for another one.
Reassured the wife.
Reassured
Exactly.
The wife, yes.
Absolutely. She went back to the patient.
Yep.
Your main priority is who?
Patient one.
Exactly. If you need to remove that stressor out that room, whether it's the husband that's anxious or a woman that shows up to the ER with her 3 kids because she has nobody to watch them, but she's stressed out and she's there for something cardiac, are you going to keep those kids in the room?
No.
You're going to
Some
ask, who
crayons
can I
and a
call?
book or something.
Yeah.
Something,
Yeah,
something,
yeah.
exactly,
Keep them
exactly.
occupied.
So you have to remove the stressors that are going on. If the kids are running around rampant, give them something constructive to do. See if you can't put
Yeah.
some Disney on the TV or something, some type of kids program so they can be fixated on that rather than mom.
Maybe even turning the TV on when he was in there and asking him if he wants to watch a show with his wife, while she's getting the chemo, and then I'll go call the library, something like that.
But what was the first thing you had to do before you did that? No, you have to take care of what he's fixated on.
Right, which is the book.
Correct. By calling the library or figuring that out, that alleviates that. And then you do the calming, the stressors, the food, all that kind of stuff, because that's going to help him. Okay. You have anything to add? I think you did a great job.
Yeah,
Mm-hmm.
it's a tough, again, no disrespect, and maybe the words I'm using sound disrespectful, but you can't argue with crazy. And when I say crazy, you know what I mean by that. I mean, this is not, none of this is anyone's intention to be difficult. Psychiatric illnesses, including addiction, is controlling. It's controlling. So keeping the human behind it all is important. But you can't change it. You can't argue it away, or you can't try to get them to be rational because they're not rational. So just working with that as best you can while setting your boundaries and not allowing yourself to be manipulated into it all is important. And sometimes just saying, I don't, even saying it to them, depending on the situation, I'm doing my best to take care of you. Like with the borderline personality addict, the addict, which was the borderline, the addict,
Which one?
the
Diabetic patient.
The foot?
the foot patient, yes.
So that was the addict.
This is all I can offer you, that sort of thing. I cannot give you more pain medicine, which is the boundary set. What else can I do for you? You know what I mean? Just something like that. You can't change the person's rationale for it, but redirected it.
But I think you all did great. And thank you so much for participating, but I think it went really well. Thank you.